All right, today we're doing a deep dive into the chemistry of a really common and really powerful antidepressant, venlafaxine.
It's a medication that gets prescribed all the time. But have you ever stopped to wonder what's actually happening inside your head when you take it? What's really going on in there? Well, let's break it all down.
So to start, what is this stuff at its core? It's known as one of the heavy hitters in the mental health toolkit, and for good reason. But all that power, well, it comes with some pretty unique characteristics. Okay, so its official name is a bit of a mouthful. It belongs to a class of drugs called Serotonin-Norepinephrine reuptake inhibitors, or as we call them, SNRIs. What's interesting is that it was one of the very first SNRIs ever developed, and it got a reputation right from the start for being particularly potent. That word, potent, is key. So how does it pull that off? To really get it, we need to take a quick look at how our brain cells are constantly talking to each other. Just think of your brain as this giant, super complex communications network. And the messages getting sent around are these little chemicals called neurotransmitters. They're like tiny text messages that control your mood, your anxiety, pretty much everything. And for our purposes today, we're focused on two big ones, serotonin and norepinephrine. Now, after a message gets sent, the brain has this amazing built-in cleanup crew. The cell that sent the message basically reabsorbs the messengers it just released. This process is called reuptake. It's totally normal. It's how the signal gets turned off so the system doesn't just get overwhelmed. So here's where venlafaxine steps in. Normally, a neuron sends out its message and then it gets recycled almost immediately. But venlafaxine acts like a blocker. It literally gets in the way of that recycling process. The end result? More of those mood-regulating messengers are left hanging around between the cells, which basically turns up the volume on their signal. And here's a really unique thing about venlafaxine. What it does changes with the dose. At lower doses, it pretty much only targets serotonin. But as you increase that dose, especially over 150 milligrams, it starts blocking the reuptake of norepinephrine too. That's when you get a powerful dual-action effect. Okay, so we understand the how. Now let's get into the why. What kinds of conditions would you use this kind of dual-action mechanism for? Well, venlafaxine is officially FDA approved for some pretty major conditions. We're talking major depressive disorder, generalized and social anxiety, and panic disorder.
And on top of those official uses, doctors also prescribe it off-label for other things where there's good clinical evidence it can help. This includes things like managing certain types of nerve pain and even helping with hot flashes that come with menopause.
All right, let's switch gears. So you take the pill. What happens next in your body? Because how your system processes this drug actually has a huge impact on what it feels like to take it, especially when it comes to timing your doses. This number right here is absolutely key. 5 hours. That's the half-life of venlafaxine itself. That means half the drug is gone from your body in just 5 hours. For an antidepressant, that is incredibly fast. But there's a little twist. Your body breaks venlafaxine down into another active chemical that also helps with depression. That one lasts a bit longer with an 11-hour half-life. But even when you add them together, this is still a very short time in your system compared to most other antidepressants. And here's the crucial takeaway from all that. Because this drug and its byproducts leave your body so quickly, missing a dose is not a small thing. The drug levels in your brain can just plummet, and that is the direct reason why people can feel noticeable and often pretty unpleasant withdrawal symptoms. Which brings us to a really critical part of this whole discussion, the risks and the side effects. Like any medicine this powerful, you have to understand and respect its profile. Let's start with the more common side effects. When people first start taking it, a lot of them report things like nausea, dizziness, or sweating. The good news is these often get better over time as your body adjusts. But then you have the more serious risks. Because it affects norepinephrine, it can raise your blood pressure. It also has what's called a black box warning, the FDA's most serious kind, for a potential increase in suicidal thoughts, especially in younger people. And there's also the risk of something called serotonin syndrome, which is a dangerous, potentially life-threatening buildup of serotonin. Now let's talk about stopping the medication. One of the most unique and widely reported symptoms is something people call brain zaps. That feeling is part of what's known as discontinuation syndrome. It all goes back to that short half-life. Stopping venlafaxine abruptly can trigger a whole host of awful symptoms, from extreme dizziness to flu-like feelings and, those notorious brain zaps. And that is exactly why it is absolutely critical to taper off slowly with a doctor's guidance. Drug interactions are another huge deal here. Mixing venlafaxine with a class of drugs called MOAIs is an absolute no-go. It can be fatal. You also have to be really careful taking it with other drugs that affect serotonin, or even common painkillers like NSAIDs, which can increase the risk of bleeding. So when you look at the whole picture, the powerful way it works, the real benefits, and the significant risks, you start to see the core challenge of using this medication. It really is a balancing act. So here's the main takeaway. Venlafaxine is, without a doubt, an effective tool. It's helped so many people who didn't get better with other treatments. But it's not a simple medication. That effectiveness comes with a trade-off. It demands respect, it needs close monitoring by a doctor, and it takes a real commitment from the patient to manage it carefully. And that leaves us with one final thought. Venlafaxine is a powerful tool, for sure. But for any one person, the real question is, are its powerful benefits worth the very careful management it demands? And that's a crucial conversation to have with a doctor. Thanks for joining us for this explainer.